These are the ortho tests for the hip that are done prone. So we'll start with Craig's test. So you'll need your goniometer here if you have any introversion or retroversion. So you'll bring the knee up to 90 degrees. Your patient is prone. Make sure that you have them draped appropriately. Then you're going to feel for the greater trochanter. And then you're going to bring the knee the hip into internal and external rotation until you feel that the greater trochanter is in line. And then if you're outside of the 15-degree angle for antroversion, so antroversion meaning the hip is antroverted, so your leg is out here, you'll want to measure it if it's beyond 15 because 8 to 15 is the normal range of motion. And then if the greater trochanter is even and parallel to the floor when the hip is externally rotated here, then it's retroverted. And so if it's less than 8 degrees, then you'll want to measure that. Carol was normal, so we're not going to have to measure that for her. Next is hips. So you'll stabilize the pelvis and then bring the hip into internal rotation. Carol, any pain with that?
No.
No? Okay, then you'll do that on the other side as well. Then yeomans, so bring the knee up to 90. You'll reach your hand in around to the inside of the distal femur, stabilize at the pelvis, and pull up. Any pain with that?
No.
Okay, repeat that on the other side as well. So I'll show you what that looks like here. So take your hand here. You can rest the foot on your shoulder, and then bring that up like this. And any pain on that side, Carol?
No.
Okay. And then with the femoral nerve stretch, this one is very similar to yeomans, except that we're going to bring the heel to the butt first. Any pain with that?
No.
If they don't have any pain, then you can bring them into hip extension as well while keeping that knee fully flexed. So that's the difference between yeomans and the femoral nerve. With yeomans, the knee's at 90 and femoral nerve has the two parts. And that is the end of the prone orthos for the hip.